Hello, I'm Mabel Jung, and you're watching the World Healthcare Congress interview studio, and I'm so pleased to welcome James Evans to the chair. He's at McKesson Health Solutions, Vice President of Financial and Network Management. James, thanks for stopping by.
Well, it's great to be here.
Well, you've been out on the road talking to a lot of people about the evolving healthcare landscape. What are some of the things you've observed with the people that you've been speaking with?
It's a very, very busy market and a lot of uncertainty. So everybody's trying to figure out how do they deal with the uncertainty. Payer, provider, what's their role in the emerging healthcare landscape? How are they going to function? How are they going to get paid if you're a provider? How are you going to pay if you're a payer? What's your network strategy if you're a payer? What's your role in the network if you're a provider? And so we're seeing an awful lot of dynamic conversation, but it's married with a tremendous amount of uncertainty.
And we also have a lot of deadlines looming ahead. So what are some of the things that the groups that you've referred to, how are they preparing in light of the fact that there's not a lot that's certain?
Well, we're actually seeing them deal with something we call compliance fatigue. So between another 50-10 shift later this year and then ICD-10 in the fall of 2014, that's eaten up the vast majority of what would have historically been discretionary IT or discretionary strategy frameworks. So what's left over is what they're allowed to do to transform their business, to change their interaction with the market, to try to engage consumers. So that compliance fatigue is a real dynamic. And then what they have left over, they tend to think about being very flexible, saying we're not exactly sure what's going to happen, but let's be prepared for the range of options that we see in the market today.
And in the meantime, the investment continues into the IT.
They have no choice.
Okay.
They have no choice.
What are the best? Some of the best solutions that you see going forward that are headed in the right direction?
Well, so we're seeing organizations specifically in the payer side making investments in network strategy and in provider data management frameworks. So they expect that these tool sets are going to allow them to be very nimble in network design, and it's going to therefore feed up to the kind of products that they can put out into the market. The expectation is that exchanges are likely going to go through multiple rounds of refinement.
Yes.
Not exactly sure what the end state will be, but they need nimble systems. And the expectation is also that the kind of network strategies, very much a PPO orientation, isn't going to survive. So they're going to try to do different things, but they don't know exactly what. So put some money into provider data management and your network frameworks in order to support whatever that flexible opportunity is. Similarly, payer and provider, looking at reimbursement modeling tools and cost management tools, understanding how am I going to get paid in a variety of different episodic frameworks or bundled payment arrangements or P for P or risk arrangements, and then being able to model that in a way that really makes sense.
And how is McKesson Health Solutions responding to this?
Well, we work in both spaces, both in the network space for the provider data management as well as providing reimbursement solutions, ones that take into account the continuum of contract to policy to reimbursement strategy, and not merely providing that for the payer, but giving the payer a way to expose that and make that modeling information available to providers as well. So we spend a lot of time trying to understand, hey, everybody needs to work off the same score sheet. How do we make sure that that happens?
Well, the reimbursement for outcome, for instance, is that becoming more clear on how that's going to be defined?
Well, we expect that there's going to be both clinical and quality metrics that are going to be built into the payment system itself. So not merely taking into account what was the claim and what did the claim say, but was this the right patient? What was the risk strata for this patient? Do I need to change the reimbursement framework because this patient has comorbidity or they're being cared for under a diabetes orientation or some sort of medical home model? All these things have to be taken into account, and we're actually trying to make investments to significantly increase how flexible the systems are.
Okay, and how does that happen? I mean, what specifically?
Well, you need to be able to integrate pricing and policy. So you can't just say, here's the CPT code, let me pay it, or here's the price, here's the fee schedule, let me pay it. You need to say, here's the full clinical context, and on that basis, this is the right contract, this is the right policy, this is the right payment or fee schedule, and they have to all be coordinated. And you can't just do that in isolation. So we're actually taking contract and policy and reimbursement intelligence. We're trying to merge them together into one modeling and one reimbursement environment.
Certainly a lot of data needs to be collected before even October 1st when some of the exchanges go online.
Right. Okay.
So what is your final word or word of advice on what people should be doing if they're not already working with you?
Well, stay flexible. And the expectation is that nobody's going to be exactly right, but that this change is coming, and that accountable care changes in networks, changes in care delivery are real, and the reimbursement changes and the network changes that will come with them are also going to follow. So everybody needs to be really flexible, and investments in flexibility will long-term pay off.
Okay. Wise words. Thank you so much, James.
Right.
Thank you.
Great to be here.
I'm Mabel Jong. Thanks for watching.